Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. July 6th update on COVID. First statistics, we're at about 450 hospitalized patients. I think Baptist Integris is up to about 86 or 88. We have about 165 in the ICU. So the numbers are all rising because of the surge of cases, unfortunately. About 450 new cases yesterday. Sunday's always the lowest day throughout the country, generally 46,000 cases nationally. So big numbers, almost 3 million total, well over 130-some thousand deaths, well on our way to 150 and then 200,000, unfortunately. It doesn't seem like the surge, unfortunately, is going to be short-lived like it was originally predicted. A lot of factors again, easing of restrictions, the demonstrations, all the things I've mentioned. Just is what it is. So we have a lot of cases. So I think our best bet to try to limit cases again is do your best to stay separate from people. Don't go to bars. That seems to be a central spot. Don't get packed into places. Wear your masks. And for those of you who hate masks, just remember there may be two scientific opinions on masks where masks may be helpful or maybe not. And it's not anything to get emotionally distraught about if you're someone who needs a mask or you feel you don't. You don't have to get very angry if there's differences of opinion. One of the things we're going to talk about tonight is getting so angry because of differences of opinion. Why do we have to get so angry about differences of opinion? Can't we just communicate and get along? So the bottom line is masks are probably important overall because they may inhibit you from spreading it. And occasionally, if you have a decent mask like a KN95, it's going to probably help you not get it. And, if you sneeze when you're wearing a bandana or something, it's going to help. So the bottom line is be respectful and don't be spastic if someone's wearing a mask or not wearing a mask. Everyone's allowed to make their own choices. And if there's someone not wearing a mask by you and you think masks are important, just move the heck away from them. It's okay. And you can always go, hey, you don't have a mask on, I want you to stay away from me. But nicer than that, perhaps. You can think of better language or something. And let's talk about communication. So one of the things that's happening is intimidation. We're seeing it with the FDA. I just put a post on going through the science of why I can write Plaquenil or any physician can write Plaquenil. I wrote 2 or 3 prescriptions today, one the day before that for people who probably had COVID. So you can write that prescription if you're a doctor, if you want to. I mean, I feel very comfortable writing it. I know the science. But the thing is, there's a lot of intimidation about it. And so one of the things about intimidation is it may affect some people, and I think it's affecting a lot of doctors and providers into not writing it, thinking they're going to get in trouble or they don't want to deal with all the criticism. Likewise, if you're a physician and you don't want to write it, don't be mad at the people like me who do write it. We can write it. I'm a doctor. I'm board certified in obstetrics and gynecology. I know a reasonably large amount about infectious disease for someone in my specialty since I was in the public health service and wrote the paper on prevention of iatrogenic spread of HIV in 1987. I have formal training in infectious disease prevention and spread. Sorry, it's just one of those things. And so because of that, my long-term interest in this, I've gotten involved because I noticed in February, well, really in January, the FDA was doing something I didn't agree with. They were willfully and purposely lying. And since I was in the public health service, I also understood it is okay ethically for them to lie. It was one of the things that was kind of gently talked about because we knew more about health than everyone else. I disagreed with the things they were lying about early because I thought it would have been helpful to be honest. And so I started posting, and that's why I began this whole journey. And likewise, just to confirm everything I'm saying, Fauci admitted 3 weeks ago they lied all about masks, just like they lied about it not being a pandemic, just like they lied about it not being infectious from person to person. So it's all okay. We just have to go with the flow at this point. But when we talk about intimidation, one of the things I want to discuss briefly is, hey, if you want to criticize me, criticize me. It's great. I don't care. I have broad shoulders and I'm science-based. I can defend what I'm saying. However, sending personal attacks against my family and my children is inappropriate, which some of you have been doing because you disagree with me. So, hey, that's not appropriate. Criticize me, say I'm a terrible person, I'm a rat, I'm a horrible person, whatever. I don't know anything, I'm dumb. But personal attacks on my family is crossing a line. And unfortunately, people in this country, because of social media, feel very free to make truly terrible comments that are upsetting, but aren't necessarily what would be the right word? Successful in achieving your goals of intimidating someone like me, but it gets back to the point of why people can't get Plaquenil prescriptions because of stuff like that. So just really focus on politeness and polite conversation and polite messaging. You can say very politely, Noel, you don't know anything. It's totally fine with me. And tell me why, and we'll debate it. It's okay. I can learn. I've learned all the time. I've made mistakes in my posts, those of you who've watched, which I've then addressed. Because again, now and then I think I've read one thing right and I read it wrong. So it's just how it is. So when we're thinking then about the FDA is really trying to stop any treatment strategy for COVID. If you've noticed, like if you have influenza, there's all these normograms that you can look to if you're a doctor or a nurse practitioner or a PA. Do this, do this, do this. There's nothing from the FDA on COVID for that. They are not doing anything. The only thing they're doing is saying, don't use Plaquenil, it's bad, even though all the data shows it's not. There was a Fox News story, sorry not to offend anyone about Fox, because Fox is a political subject, illustrating once again, hey, there's this data coming out that Plaquenil really works. Just like I posted another paper saying the 7 things you need to do if you're an outpatient with COVID. I didn't write the article, these really smart scientists did. So why not listen to what they said? They said, hey, stop smoking. B, because their number one thing was do no harm. Let's talk about stuff we can do for patients that does no harm. 1, stop smoking. 2, lose weight. 3, take elderberry. I would say elderberry or zinc. 4, hydroxychloroquine. Hydroxychloroquine, it's safe. It doesn't affect people negatively on normal physiologic dosing. Now, if you look at what the FDA did, and that means you look at the FDA trials where they dosed people 800 milligrams at once, or then they gave them, or chloroquine, 2,100 milligrams at once. What's the dose of chloroquine to inhibit COVID? 250 milligrams. So hey, if we give 10 times the amount, it's going to have side effects. So again, that's the problem with the FDA trials. They were set up to fail. But again, that was one of the things they mentioned. Antibiotics. This is one of the things that I think people are forgetting about, and the FDA has not emphasized at all. Now, thankfully, critical care doctors in Oklahoma City, and I think the rest of the country, get this, but why not mention it routinely to everyone? And all these doctors who, every time they get called on a COVID patient, throw up their hands and just say, go to the ER. They say antibiotics. One of the reasons Z-Paks probably help people is in a Chinese study on pediatric patients who were admitted to the hospital. 50% of them, which I've talked about before, had another primary respiratory infection, a third of which was walking pneumonia, which is mycoplasma. And mycoplasma is covered by a Z-Pak. So when you start thinking 50% of people have another infection in their lungs when they're coming in with their COVID infection, antibiotics play a role. Another thing they added was steroids. The original thought process was steroids were bad. It's looking more and more like low dose, low intensity inhaled steroids early in the course could be very helpful. Just like dexamethasone, if you wait and give that in a critical care patient, which is the whole point that I'm going to get to, is helpful. We don't want people to be in critical care. We don't want people to get sick enough to get in the hospital, because if you get sick enough to get in the hospital, half of those people go into the intensive care unit, half of those people die. So if we keep them all out of the hospital, we don't have anyone die. That's a great goal for all of us, and that's my goal when I'm talking to everyone. It's about stopping death. We don't want people to die, and stopping morbidity. So those were the central things. I'm forgetting one, but I'm a spaz. But those were the central things. Everybody needs to be doing that for their patients, and they need to not just say, hey, go to the ER every single time if they're a little bit sick. Have them get tested, do some stuff, or tell them to go to the ER, then tell them to call you if they send you back home. And you can do things to help them. The doctors can't. And so, but understand as a patient that there's so much negativity for providers to write Plaquenil now, it's going to be hard. It's going to be hard for them. Systems don't want them to do it, and umbrella organizations criticize them, so everyone gets intimidated. Some of us are just dumb and believe in science and use the data. And I would always say the one person who's probably not reading the data is Dr. Fauci, since, everything I'm always saying, Harvey Risch, head of epidemiology at Yale. This is the Yale program. Everything I'm preaching, it's from him. It's the Yale data. It's what they're doing at, again, for those of you who haven't heard of it, Yale. So they're smart people. They're smart people. They're smarter than me. but I'm good at copying. That's always been my claim to fame. I read tons of literature all the time, and I go through it, and I read it, and I analyze it, and I look at it and go, this is a good idea. Nah, this isn't so good. The statistics are good. Not that I'm great at statistics, but I understand them somewhat. This guy's a brilliant physician. That's why he's recommended this formally. So that's really what I want to emphasize. We're going to have more and more cases. We just have to be ready to treat them. Zinc, elderberry, vitamin D, melatonin, the standard stuff I've talked about a million times. You need to be on it to bump up your immune system. Again, something the FDA doesn't tell us, because the FDA isn't going to tell us anything other than we're going to have a vaccine for you in the fall that's experimental, and we're just going to vaccinate everybody and hope it works. And they have no idea if it will work or if it will be safe. So those are the central things. Oh, World Health Organization. So a couple things about them I think that's very important. Some people have been upset that Trump dropped out of the World Health Organization. Some people don't care. Some people think they're idiots. Let's just be honest for a second. They admitted today they completely lied, and you can look do a search on Google, Dr. Google, or whoever you want. They said they lied today. They didn't say they lied. They said, oh, well, everything we said about how the coronavirus started and that the Chinese government told us, oops, in passing, wasn't true. They never told us that the coronavirus had started or there was a pandemic or anything. What actually happened is our Beijing office happened to notice a small news report in the Wuhan business section of a paper, and then researched it and figured it out and started contacting the Chinese government. And that was in the very end of December, which is even more interesting because the Taiwanese government, or CDC, had contacted the World Health Organization in mid-December and said, hey, we have an infectious disease coming out of China, and we think it's serious, it's respiratorily spread human to human. And the World Health Organization blew them off, said, no, you don't, and ignored it, and then spent through mid-January saying it's not spread person to person. Well, how the hell is it getting spread? Okay? The first case from December 8th that they admitted to was a lady who hadn't been in the meat market. And if it was contact only in the meat market, for those of you who followed along, how could it have not been human to human? It's so bad with the World Health Organization now that a group of 100, I think, of 32 scientists have written a position paper asking them to admit that there is direct human-to-human transmission, not with just coughing, but with just breathing and activity and contact, because the World Health Organization still says the only way you can get COVID from someone is if they directly cough on you, which we all know that's baloney. But hey, that's the World Health Organization. They should be defunded because they're just as corrupt as the FDA. But that's here nor there. What else am I supposed to talk about? We made a list.
I think you hit it all.
I hit it all. So for those of you who I've offended, don't watch me anymore. For those of you who want some level of truth as I know it as I'm researching it, I'm the person perhaps for you to continue to listen to, but I'm always going to just give you the data I can find, read, research. It's very well documented. Every single thing I said tonight, the World Health Organization has lied the whole time. The FDA is actively pursuing an agenda to not help the American public. They are not suggesting any training to doctors, any education to physicians. Every single critical care physician and hospitalist and pulmonologist and internist and infectious disease doctor who's taking this great care of patients, and all these nurses, they're doing it on their own. They're communicating across the country to each other in chat rooms and figuring out how to do this. They're getting no help from the FDA. Okay, really, very limited. So I follow the Yale people. The Yale people are knocking it out of the park. We have great doctors here in Oklahoma City who I won't even name because I don't want anyone to get associated with me and get negative connotations because I said they were awesome, because that's what I've realized is going on now. So we have great doctors at Baptist and great doctors at St. Anthony's and great doctors in Norman and great doctors in Midwest City and great doctors at OU and great doctors at Mercy. And if I'm missing any of the big places, I just want you to know there's great physicians and support staff and nurses and respiratory therapists there for all of us. It's just I would like you to avoid having to go to the hospital. I want you to not get that sick. So take care. Good night.